Good news for President Obama, and it has to do with Obamacare. Apparently, the uninsured rate of adults has fallen to the lowest level that it's been at since before he took office. Now, the number is still, from my point of view, far too high, but let's take a look at this chart. You're seeing this coming from Gallup, and you're seeing a precipitous drop there, mostly actually occurring in the first quarter of this year, dropping from 17.1% to 15.6%. That, by the way, it's easy to just see it as a couple of percentage points. That's about 3.5 million Americans. And if you've ever been without health insurance, you know what a difference it makes. And now we're talking about a difference for millions of people. So you had the insecurity of not knowing what would happen if you got sick. Now millions, perhaps because of the launch of Obamacare, now don't have to worry about that anymore.
I think one of the offshoots of what's happened with Obamacare, and we've noticed, of course, we always look at the numbers of uninsured, which is very important, of course.
Yeah.
But in some of those stories, which thank you to some of the Koch brothers, Americans for Prosperity ads, have told us as they debunk these lies that they're telling, that sometimes people are underinsured. You know, and some people didn't realize that either. And that was one of the things that wasn't talked about. People would, oh, I'm insured, I pay my $95 a month. That's awesome, it's kind of cheap, it's okay. I'm worried if something happens to me, and it covers very minimal damages that could happen to you. You say you get into some kind of issue. Well, when you're putting in things for your car insurance, you look into what kind of bodily damage do I need to cover me in this, and you don't think those things cross over. But when you're buying car insurance, you're talking to your agent, and sometimes they go, well, you know what? You live in Los Angeles, that's at least what I get. You live in Los Angeles, there's a lot of BMWs, Mercedes, we're going to talk about Teslas later, these very expensive cars that people drive in this city. And if you hit one of those, if you're only insured for covering someone for $10,000, that's not going to cut it. So people don't think about that when it comes to themselves. And this is one of those things that also covers that. I'd like to see also the chart on underinsured getting something better.
I think that would be a great thing to see the number of underinsured people who are now moving into being insured. What I think is most extraordinary about this is the fact that there were so many people who were uninsured, who could not get access. I mean, they could go to the emergency room, but when you have those kinds of bills looking at you in the face, then you tend to not go and get your health coverage, your health care that you deserve to get. So to me, it's very funny that we're still hearing from Republicans politically that this is a disaster, and it's almost becoming almost to the level of like the birthers, where it doesn't matter what information comes forward, it doesn't matter what data comes forward to show that the program is working as intended. It was intended to insure people who are uninsured, and it's insuring people who are uninsured. It's working as intended. And how long it's going to take before that information actually trickles down to the public.
And so in advance of when we were getting towards the deadline, and we wanted the 7 million people to sign up. That was the goal that was stated. The Republicans were saying he's not going to get to it. Now that they did get to it, they're just saying, well, what do those numbers even mean? Are they paying yet?
Have they paid yet? Because that doesn't even count if it haven't paid yet.
Exactly. And look, I think I don't necessarily trust the numbers that the administration is going to put out there, but I mean, you can't doubt that something is happening. It's much more successful than they had thought it was going to be, especially during the rocky launch of the website. I liked what you brought up about the emergency rooms, because people being forced to go to an emergency room doesn't just mean that they wait until the last minute and their conditions likely become much worse during that time. It's also far more expensive for America because they're not able to pay for those emergency room bills.
Who pays for that?
Exactly.
Taxpayers do.
Exactly. So rich people understand this is better for you in many ways.
And this is the type of information that it goes back to your point of how it trickles down to the rest of society to know what we're getting into. And in the meantime, as it's happening, there's always distractions coming through. First, the website, it ain't working. It ain't working. So once they think that, it all connects to, then the whole process is going to work, the law is going to work, healthcare sucks, you're going to lose your doctor, all the things happen. And instead of it going directly to a point of this whole thing, you keep getting, I guess, hurdles thrown in the way, which, some were thrown in by themselves when they did things rocky, but it doesn't go back to the original source of trying to, again, insure the uninsured.
Right. And when you have a program that's actually working, obviously, it doesn't help the Republican Party for them to actually admit that it works. Now, of course, nobody is saying that it's a perfect program. It's not a perfect law. I think I would prefer Medicare for all. I would prefer the single payer option. But absent that, we have this, which is actually helping a lot of people, and it's actually helping to bend the cost curve for both the rise in insurance premiums for people who already had insurance, but also, I mean, people that already had insurance that met the minimum standards, but also for overall, you know, if people are able to access preventative care, then they are able to avoid having to go to the emergency room when they've gotten too far along and they couldn't see a doctor before. That's what we had in the past. We don't have that now. It is actually starting to bend the curve that we're all paying, whether it's directly or indirectly, that we're all paying for health.
So we showed you really fast the 2.4% reduction in the uninsured rate. Specifically, though, there's even better numbers for some groups that were more at risk before this. Among African Americans, the uninsured rate dropped by 3.3%, and lower income Americans, it dropped by 3.2%. Both of those very positive. So one thing that I want to bring up coming out of this, you see these numbers, this is exactly the sorts of numbers that Obama and the administration were hoping for. And you know, after they reached their goal last week of the number enrolled, they got to 7.1 million at that point. Obama basically said the debate is over, the ACA is here to stay. And you know, he didn't want to hear from the Republicans more about repealing it and replacing it and all that stuff. And so he is sort of either trying to just influence the media narrative or accurately predicting that this is basically the end of that phase of the debate over the bill. And so from what you've seen, do you think that the president's accurate when he says that? Or will they continue to try to make this the centerpiece of the midterm elections?
Oh, yeah. I think I think they will continue.
Even with the drop in
no
the
matter what
it doesn't
happens,
matter.
they're going to. I think that the Republicans are going to run on this, and the Democrats, to me, will be doing themselves and everybody else a disservice if they run away from Obamacare. And I love the name Obamacare, by the way. I prefer that term. So I'm happy to put his name on that because I think people need to remember that that's how we got to get rid of pre-existing conditions, and how students were able to stay on their parents' insurance, and how we got a lot of people who were knocked out of the system because they couldn't make enough money to pay those ever-rising premiums. Now they are insured. That said, I think Democrats are making a mistake if they run away from the Affordable Care Act, Obamacare, in the midterm elections.
That's going to be the big decision for the election, which way they're going to go. So right now, everyone's trying to influence the other side. You better not run on that because it's going to be a problem. So there's a convincing factor now. Yeah, if you run on that, you can lose all of your Senate seats. We're talking about how the Republicans are going to take over the Senate now. If only they run on Obamacare, it's going to happen. So now it's scare tactics coming into play now to see which way they can make the other side go. So they won't have to work so hard to run on the side that they want to go for to end this whole thing. Now, the statement from Obama about it's here to stay, that's one of those things where, of course, it sounds very political, but it's very true. I was reading this morning about how once this is put into place, and again, it's under the name Obama, and Republicans, they can't then repeal it. There's this many people. That's why the 7.1 sign up for that deadline was so important, because then if all this talk actually happens to repeal, replace, and there's no replace there, we know that, there's the repeal. This many people have now lost the coverage that they've now become accustomed to, and you're not going to win that fight. You're not taking back what someone already has and they've got a taste of.
Which is why they fought so hard to make sure that it didn't pass in the first place, because they knew that once Americans got a taste of actually getting some services for the taxes that they do pay, actually helping lift a great number of people into, out of the danger zone from health problems. Once people get an understanding that, hey, I can actually get something for my taxes, something that I deserve, and something that helps everybody, they're not going to want to give that up.
Yeah, and I think, look, I still am uncomfortable about the idea of the mandate of being forced into it, but I think it must have seemed pretty shocking at first when you had to get auto insurance when previously you hadn't, and yet we've become accustomed to that. And I think that it makes some degree of sense to treat your body at least as well as you treat your automobile.
Well, it's better for society as a whole anyway.
Exactly, bringing down the overall costs.
Right. And not just the overall costs, but there's that thing called herd immunity. So when you have people who are actually going to get medical care for, say, infectious diseases, it always helps that they prevent that from spreading to the rest of us who may not have an inoculation against that.
Yeah, and as you say, like, people are going to get used to having these plans. They're going to get used to going in and then finding out, oh wait, my copays are lower. It's not just the monthly. Like, I think they're going to get more and more used to that, and it's going to be perhaps in 10 or 20 years as difficult to convince Americans to get rid of this bill as it is Medicare or Social Security.